Hello and welcome to the Integrative Health Convention 2019 online interviews. Today we're going to find out more about Michael Lingard, and he's coming to the 2019 Integrative Health Convention at the Plaza, Victoria in central London on the 5th and 6th of October 2019. He's going to speak to us about the fact that better breathing matters to health. So this is Michael Lingard. Hi, Michael.
Hi, good to see you.
Good to see you. He's an osteopath, Buteyko educator, and plantrician.
Correct.
Trained as an osteopath and does nutrition and adds breathing to his work as well. He can be found at totalhealthmatters.co.uk, and what he does, it can be found there. So, Michael, should we begin by letting the audience know a little bit more about yourself and what you do?
Okay, I'll try and keep it short. I trained as an osteopath. I set up with others the first holistic clinic in the southeast of England in 1981, a long time ago. I added breathing training to my work with the Buteyko method about 16 years ago. And then I had my own place, Total Health Matters, in Kent. And I had kept away from nutrition for many, many years, because every time I looked at nutrition, there was a different story and a different way to approach it, until I met something called the China study. And I read the book, fell in love with the book, did the course on the internet with Cornell University, and I've added now nutrition to my work at the clinic here. So every patient I see now, I try to check the structure, their breathing, the diet, give them advice on all three. Whether they take it or not is entirely up to the patient, but there you go. Okay.
Quite an integrative, holistic picture.
Yeah, I try to, but I did write a book called Connection, because I've been studying health all my career, a neglected area of study in medicine, by the way. Pathology is the key area. And I came to the conclusion I wanted to find out what was health connected to, and I took a lead from a Scott Williamson, who was a great pathologist back in the 30s. And at the age of 60, he asked himself, I know pretty well the origin of most diseases, but what's the origin, the etiology of health? And he didn't have an answer. So he looked in all the medical libraries, couldn't find anything in the medical libraries in this country or America. Nothing much has changed, I'm afraid. And that's been the theme of my work over the past 30 years. And so I wrote this book and say, what is health connected to? Hence the title, Connection. And it's obviously connected to structure. My interest in osteopathy is connected to diet, what we eat matters. It's connected to breathing. Curiously, that is very important, which I shall deal with later. It's connected to mind state, to family, to environment, to the community you live in, to the environment you live in. And eventually, the last chapter of the book is the cosmic connection, which makes people laugh. But I say, well, if you switch the sun off, we're all dead. So there is a cosmic connection at the very base level. Does that give a background a little bit?
Oh, good. Because I was going to ask you about that, but you've said that already, so that's great. And you were going to talk in October at the Park Plaza about
specifically breathing.
Specifically, better breathing means better health, and about the Buteyko method, which actually I think I mentioned to you. I remember reading something about it, and I'm sure it was the British Medical Journal back when I was a student or a young doctor. And it was actually funded in some areas of the country until they cut funding, and then that was probably one of the first ones to go, unfortunately. They also funded Qigong and many things like that, which subjectively made a huge difference. So I'm glad we're having you come talk about it. Can you tell us a little bit more about what the audience will get out of it?
I like when I talk about breathing, I like to give people something to go away with. And what is interesting, in the past, I've had small meetings in my clinic here for people coming along to learn about it. And some of them are actually later on booked on a course. But between hearing my talk and starting the course, their breathing's improved, simply because they know more about what happens when you breathe. So I rank it as probably one of the most neglected areas of healthcare there is. In the East, it is central to all medicine. In the West, doctors are only interested basically if you've got bronchitis or asthma or something wrong. I may be a little bit unfair there, but that's the picture I get. Well, so I will get the audience. I'll check all their breathing, which is great fun, because you can, whatever, it's 50 people or 100 or whatever, you can check all their breathing. They have a measure of it. So this is measuring how well oxygenated their body is, basically, using a Buteyko technique. I will then probably give them some advice on how they can improve their breathing. And I have a simple A4 sheet, which really covers this remarkably well. And very soon I'll be launching, in fact, it's just launched, a podcast, which is 15 episodes with the entire Buteyko course, and it's free on the internet. Reason for this, I've been trying for years now, trying to launch Buteyko locally. Normally, people visiting me, it's too expensive. And in this country, people don't like paying for their healthcare because it's on the NHS. So there you go. So I thought we'll try and see what happens when it's free. The other thing which I will add, which is, I think is new, unique is not a word I use, but new. Over the past 2 years, I've been collecting data on all the patients I see, looking at their breathing and their diet. And I find a very strong correlation between diet and breathing. So what we eat affects the way we breathe, and the way we breathe affects how we choose what we eat. So these two things are very tightly linked. There's a high correlation. This has come as a surprise to me and to many other people. A little bit about that as well. Okay.
Sure, because one of the feedback things from last year was that people wanted to learn a lot more about how nutrition plays. And this year we're having a couple of speakers come, some of the president of the Natural Association of Naturopaths, and we've got the College of Medicine lead for nutrition, and they're going to come and talk about food. But I'm sure they'll be interested about finding out about the link between breathing and nutrition, because I've never.
No, I mean, this is one of the things which you can explain the diet to breathing quite easily, physiologically, is that I warn my colleagues in the States with their Buteyko training, check people's diet first, because the Americans tend to have a richer diet than we have. And they're slightly more obese. And because of their high consumption of meat and dairy produce and refined foods and convenience foods and Coca-Cola and everything else, they have a very acidic body. And there is a simple buffer mechanism within our body. We can deal with the acidity 2 ways. We can either draw calcium from our bones, which is not a brilliant idea, or you can hyperventilate and push out a lot of CO2. So somebody with an American-style diet, or they call the standard American diet the SAD diet, they are going to be acidic, they're going to be hyperventilating. If my colleagues teach them to breathe normally, there's only one thing that can happen then, is that the calcium's drawn out of their bones and they have osteoporosis or kidney stones as a complication. So not only is this correlation important, of interest, but I think it is also clinically very important that both the nutritionists and the breathing people recognize this link. So that's a fairly easy way of understanding it. Once you have a diet which is more neutral, a little more alkaline, you still have overbreathing, but that's perhaps because of stress and bad habits. That's another matter. On the other side, when you're trying to say, well, if somebody breathes badly, why does that affect their eating habits? If they breathe badly, the chances are that they are stressed. I believe you cannot be stressed if you're breathing calmly and quietly. This is mindfulness, is breathing, breathing, breathing. So if you're breathing badly and you're hyperventilating a lot, you are stressed. You're grabbing a sandwich whenever you can. You're having a Mars bar when you're hungry. You don't think about what you put in your mouth. If your breathing is good, then you are calm, you're relaxed, you're considerate, you sit down to a meal, you enjoy the meal with your family or whatever, you think what you put into your mouth is important, and you're more considerate as to how you eat and what you eat. That connection is more delicate, if you like, but the other one is a simple physiological connection. Hope that helps.
Yes, thank you. Because that sort of answers my next question, was about how you think it fits in with integrative health, and suddenly like you were saying, it's holistic.
It's terribly difficult. I mean, people come to me obviously because primarily I trained as an osteopath. They come through with a bad elbow, and I can't do an elbow. It's almost the pathology with me is that I have to do a whole back. And now I can't do a whole back without thinking of the diet and without thinking about the breathing and thinking of their state of mind. So it's difficult. Yeah.
Brilliant. Yeah. I was just reading the other day, just reminding myself, the WHO definition hasn't changed for quite a long time on health. And it says physical, mental, and social. And only now are we, with social prescribing, are we addressing social? We've never addressed it.
It's coming back. It's coming. We've almost done a full circle.
We are. Yeah, that's right.
I mean, the story goes back to the other thing, the Peckham experiment with this Scott Williamson in London. Most people have forgotten about this, but this was the great experiment of its time in health in the 1930s. And this pathologist, he set up this center in Peckham, the beautiful building, glass building. Families joined, and they had a cafeteria, they had gymnasium, they had a creche there, and a very simple medical center. And all the families joined. They had to join as a family, paid a nominal sum. They had to submit to an annual health audit. And they were allowed to do whatever they wanted once they got there, which is weird. They had a swimming pool there as well. The kids joined, and you had a very rich community. And at the end of this exercise, there's before the war and after the war, 1,000 families were involved. The Queen visited the place. Every dignitary who came to this country went there because it was the most important healthcare concept of its time. And everybody's health improved by all medical measures without any medical intervention. And so when the health service was set up 70 years ago, a group went from the Peckham experiment to Bevan and said, look, if we could set similar things up all across the country, we'd have a healthier nation. And another group went along and said, there's some fantastic drugs now. If we could deal with TB and all the rest of it, if we could provide this, we'd have a healthy nation. And we all know who won the story. So that's something which the government understood. And it's taken 70 years for the whole thing to turn around. And now medics are now saying, conferences I've been to at London for doctors at the Royal Society of Medicine, a lot of young doctors are saying, well, we want to know about nutrition. We want to know about the lifestyle, because this is the bit that's missing. So we're getting there. And another exciting thing, and this is what cheers me up, is that we've got some wonderful medicine now, disease management. That's great. I mean, I have no complaints. But we're now adding to it the idea that lifestyle matters. But it's going to be difficult because we now train the entire public to ignore their own health because the doctor will fix them. And we have to give the onus and the responsibility back to the individual. And it could take a few years.
Yeah, absolutely. And I don't know if that answers the last question, but I was going to ask, what do you think in particular, with all your years of experience in what you do, that you think makes the most difference to health?
If I said breathing, that would really sound crazy. But I know I'm in good company because practically every doctor in the East would probably put breathing high up on the agenda. Because if somebody's breathing properly and calmly, they will be calm. Their diet will improve. Their stress levels will go down. We know disease is stress related, is diet related. So, wow. And that's the saddest thing of all, is in the 90s, as you said, Buteyko, I don't think people like the term. It was foreign and they didn't understand it. It's breath training, for goodness sake. There's a Papworth method, which a great doctor at Papworth Hospital, he prescribed breathing and taught people breathing with a whole range of problems. But for some reason, it never got off the ground. There were questions in Parliament, but the political will was against it. I mean, may I throw in one possible reason? Is asthma is a particular one where there's great success story. Every asthmatic, if they learn to breathe properly, can reduce the medication without a shadow of doubt. The wheezing gets less, the health improves, there's a whole range. But medics reasonably say we would like more research, because if this is applied, it's applying to 5 million people in this country, something like vast numbers. We want more research, but who in fact finances the research? It's the pharmaceutical companies, I'm afraid. And the pharmaceutical companies, God bless them, they are companies, and they're not going to do research into something which says we don't need your product. 20% of their income comes from asthma drugs. And so this is a problem area. The biggest research topic was done in Calgary in Canada. Somebody donated $1 million. And this was a brilliant piece of research. They took a top physio respiratory expert with one group and a Buteyko trainer with the other group. And the difference was quite amazing. The Buteyko group far excelled the standard training. So we are in a dilemma, is that there is a market force which drives medicine in a certain way. And I've always thought that yoga probably saved the NHS millions of pounds. People going to yoga, but it's not on the NHS. It could come.
Wonderful. Thank you very much, Michael.
My pleasure.
Brilliant. So thank you to the audience for listening to this interview. Remember to get your tickets early now from our website by following the links below. We are the Integrative Health Convention at the Park Plaza, Victoria in London on the 5th and 6th of October 2019. You can use the discount code video5, which will give you a 5% discount as a gift from us to you for sharing your time with us. So when we see you in October in London, you'll get to meet myself, Michael, and all our amazing speakers there who will share so much more with you then. Thank you. Thanks a lot, Michael.
Bye.